Medical examination process for armed forces selection. Introduction. A candidate recommended by the Services Selection Board, SSB, must undergo a comprehensive medical examination, also known as the Special Medical Board, SMB, conducted by a board of service medical officers. Only candidates declared fit by the medical board are considered for the final merit list. The medical standards of the Indian Armed Forces are formulated to ensure that every individual is physically and mentally capable of performing under the most demanding operational conditions. These standards evolve regularly, reflecting the latest medical advancements and operational requirements. Hence, candidates are strongly advised to refer to official recruitment websites such as the Indian Army, Indian Navy, and Indian Air Force for the most updated guidelines. Medical Examination Boards. Special Medical Board, SMB conducts the initial examination. Appeal Medical Board, AMB candidates declared unfit in SMB can appeal within 42 days. Review Medical Board, RMB candidates rejected by AMB may request a review within 1 day. Approval for RMB is granted based on merit by DGAFMS and is not an automatic entitlement. Key areas of assessment. Physical examination. Height, weight, and body mass index, BMI, measurements. Standards vary according to age and gender. Systematic health checks. Cardiovascular system, heart rate, rhythm, murmurs. Respiratory system, lung capacity, absence of respiratory diseases. Musculoskeletal system, bone and joint function, muscle strength, absence of deformities. Neurological system, screening for neurological disorders. Sensory examinations, vision, visual acuity, color vision, peripheral vision. Conditions like myopia, hypermetropia, and color blindness are carefully scrutinized. Hearing, must detect a forced whisper at 6 meters in each ear. Laboratory tests, blood tests for infectious diseases and hematological disorders. Urine tests for renal function and metabolic disorders. Specialized tests. Dental examination ensures minimum required dental points. Psychiatric evaluation assesses mental stability and wellness. Common reasons for medical rejection. Chronic skin diseases causing disability or disfigurement. Poor dental health with insufficient dental points. History of major orthopedic issues, e.g., improperly healed fractures, chronic joint pain. Persistent ENT disorders. Preparation tips for candidates. Maintain physical fitness through regular exercise and a balanced diet. Schedule routine health checkups for early detection of issues. Ensure adequate rest and sleep before medical examinations. Stay updated with official armed forces recruitment websites for policy changes. Updated medical standards for different services. Indian Army. Entries. NDA. 10+2 TES. TGC. SSC Tech. And others. Medical criteria. Comprehensive evaluation covering cardiovascular, respiratory, neurological, and mental health. Strict vision and hearing standards due to the demanding nature of service. Website, Join Indian Army. Indian Navy. Entries, Executive, Engineering, and Education branches. Medical criteria, general physical health, plus tests for aquatic adaptation, seasickness, and maritime-specific conditions. Website, Join Indian Navy. Indian Air Force. Entries, Flying Branch, Ground Duties, Technical, AFCAT, NCC Special Entry, Meteorology, etc. Medical criteria. In addition to general tests, spinal radiographs, AP, and lateral views are mandatory for flying branch candidates. For ground duties, radiographs may be prescribed if deemed necessary. Website, Indian Air Force. Conclusion. The medical examination for armed forces selection is one of the most rigorous in the world, designed to ensure that every candidate is physically, mentally, and emotionally fit to withstand the extreme demands of military service in both peace and war. By understanding these medical standards and preparing systematically, candidates can maximize their chances of success in the selection process.